Good morning, everyone. I can see our participants are starting to join us. I'll just give it a few more seconds before we kick off. We're kind of, oh, that's a big jump. It literally went from 10 to 32, like as I blinked my eyes. Welcome to this morning's webinar session. I'm probably going to kick off in about a couple of minutes. I'll give a bit more time. We recommend that you apply the side-by-side view in your Zoom settings so you're able to see the presentation as well as the speakers today. And if you would like to ask a question, please use the Q&A function and our team will respond as soon as they can, but we will have some Q&A sessions at the end, if not throughout. So I'll give it a couple more minutes. Oh, we're at 71. Oh, that's great. I think we can kick off actually. Welcome everybody. Just looking, give it a few more seconds, 74. Yeah, I think we're a great time to start. Welcome everybody to this morning's Mental Health and Professional Services webinar. I am joined today by some really great guest speakers that I'm looking forward to asking questions about. If we could go to the next slide, please, that would be great. So who's on your panel today? You probably can see 4 people, but it's actually 3 of us today, and our lovely Danny is helping and supporting us throughout with the slides. So, you know, it takes a whole team to make this work, but we're going to do this and we're going to do it as well. My name is Afrifa-Tchie. I'm Head of Culture and Wellbeing at Mental Health First Aid. Today I have the privilege and luck to have Anna Marie Jacob, who is People Experience Lead at in the UK Financial Services Department at EY, and also Tari Okoye, who is the Business Development and Strategic Partnerships Manager at Morrison's Wellbeing. Oh, good morning. We have Marvella from the United States. Thank you for joining us. It's quite early for you, but thank you for being here. In this webinar today, we'll be discussing the common stresses and strains of the sector and the impact of the pandemic has had on it, considerations for mental health and well-being in the workplace landscape, and managing and mitigating well-being challenges in the future. And I think we're going to kick off first with a couple of polls today. So our opening polls, we've got 3 questions that we would like you to answer. Our first question is, and you'll get them all together in the same poll, but how has the mental health of your workforce been affected by the pandemic? The second question is, does your organization have a mental health and wellbeing strategy in place? And the third question for our opening poll is, if yes, how well publicized signposts are the support measures offered by your organization? So I'll give you some time to answer those questions and welcome anybody else that has joined today. Whether it's in the United States or in the UK or across the world, we are so happy to have you here today. And I hope that you find today's session really informative and you've got some really good nuggets to take back. So give it a couple more minutes and then we can see some of the results. Shall we have a look at some of the results, Danny, what the poll's saying? Okay, so this is interesting. So somewhat negatively seems to be the majority. We've got a nice good spread. We've got a good spread actually. So the first question around mental health, the workforce being affected by the pandemic. The majority of you are saying somewhat negatively, we've got 59%, but actually it's an even spread between somewhat positively, neutral, very negatively and unsure. Which is actually not bad because I think the second highest is somewhat positively with 15%, so that's not a bad thing. But yes, we've all heard the stories, we've been listening to the news, and we all know that mental health and well-being, especially for everybody who's been working from home, but also frontline who have to go into the office, have had some negative impacts during the pandemic. And in terms of your organization, does it have a mental health strategy, mental health and well-being strategy in place? The majority of you say yes, so that's actually really good to hear. Although it's interesting to kind of find out, and we will be talking to Tari and Anna Marie about this, around how effective has that strategy been, especially at this time and during COVID. And in terms of publicity, it's regularly publicized, very well publicized, and also occasionally publicized, have had the majority of votes in that. So that's actually really interesting to understand. So let's dig a bit deeper into these polls. And I would like to start off first. And if I could ask you to just introduce yourselves. I have introduced you, but it would be great to get a little bit about your background and also what you do in your organization. So Anna-Marie, I'd like to kick off with you first, just to talk about that first question around you know, the mental health and wellbeing strategy, and how have you seen mental health and wellbeing impacted in the workforce that you in EY that you work with or in your department?
Thanks, Emma. So, and again, thanks for having me today on the session. I'm also the co-chair of the EY mental health community. So we have a lot to do with our people in terms of focusing on very much the human aspect around mental well-being and mental health. And we do a lot of work around encouraging people to talk and find safe spaces to ensure that they can do that. I think one of the things that we've noticed is actually some people that have struggled with their mental health historically have actually found they've coped quite well during the pandemic, because they've been able to utilise the skills that they've built up over time to protect their mental health in a positive way throughout the pandemic as well. Whereas there is evidence that people that have typically not struggled previously haven't had those they haven't already built those processes to protect their mental well-being, and they have some of them have struggled more. So I don't think it's necessarily as straightforward as I've struggled with my mental health before, therefore it's been harder in the pandemic, because actually some people have found it easier, but certainly people that haven't necessarily worried about their mental health before have found it more difficult.
Thanks for that, Anna-Marie. And Tari, if I can bring you in here, and please again introduce yourself and a bit more, and let us know a bit more about what you do. But yes, let's talk about that human focus and that human element, because majority of people have been working from home, and for some it's worked really well, and for others it hasn't. And I'm really quite curious to find out, what have you found through, whether it's through your direct organization or, you know, whether you're dealing with clients, what are some of the things that have come across in terms of, you know, mental health and well-being and how people are coping?
Thank you so much, Amma, for that question, and thank you for having me on the panel. So I work with Morrinson Wellbeing. I look after the wellbeing team there. We sort of go out to educate people, or educate the UK workforce rather, on how they can effectively manage their finances. And I'm sure a lot of you will be very much aware how, you know, mental health and financial well-being, they work in tandem. In terms of how the pandemic has affected people within our organization, similar to what Anna has sort of mentioned, I guess by virtue of the fact that we do work in the well-being space, some of my colleagues are a little bit more equipped than others to identify when they are potentially about to go into sort of a mental health spiral. So they're able to get themselves back into the swing of things. Whereas it is actually those individuals who've never really thought about it or have never been really impacted by it that I found have struggled a little bit with things. And either be it the anxiety of potentially getting something from in terms of COVID, or the anxiety of just job security, right? Which then brings that financial element. And I think the same has been identified within our clients, where we have clients who've had really good mental health strategies in place. I feel we have seen a mix. I won't say it's like a good mix in any which way, because it just varies from organization to organization, but you find that there are those individuals that are really, really struggling and are completely asking for help. And some of those individuals are people that we would not ordinarily think would struggle. But I guess also just being in that home environment, working from home, people with families, people having to balance a whole lot more things than normal, they are finding that they are drowning a little bit more than normal. Whereas, you know, other organizations who haven't necessarily implemented a lot of well-being initiatives as strategically as one would, where they sort of made them tick box exercises, they have seen a lot of issues arising. And they now have, and it's almost now like damage control. Okay, we now need help. We need to implement this. How do we implement this? Because we have so many people sort of calling in out of work, or we have so many people struggling, and how do we manage that? So it's been a mix, but I have to just commend those organizations who already have initiatives in place, because it's helped them cope a bit better with employees sort of struggling with mental health issues.
And what would you say, and this is to both questions to both of you, Anna Maria and Tari, what would you say some of those issues have been? Like, what have the surprising issues been versus the ones that you kind of would have expected? And how has your organization, whether again it's through suggesting things to clients or actually supporting your workforce, how have they actually gone about supporting them?
Sorry, if you go ahead, Anna.
I think at the start of the pandemic, and when everybody went into lockdown, it was actually quite easy to manage lots of people, because everybody, although we weren't in the same boat, we were in the same storm.
Yes.
And so it was very easy to provide support around suddenly getting people back, getting up and running at home, and all of those immediate issues. And obviously there was a lot of understanding around people with children, homeschooling, and trying to juggle all of those things. But I think as things have started moving through the pandemic, and I hate the new normal, I hate that as a phrase, but as we move into each phase, people's needs have actually changed quite significantly, because whereas before everyone was the same, we now have much more diverse issues to deal with. People that have been living on their own maybe have now realised that they just don't have a social structure and support structure around them, and they're seeing their colleagues go off and meet up with family and things like that. And I think it's really important that we recognise that you can't deal with, everybody's not in the same storm anymore. Actually, we've all got very many different issues to contend with. And actually we need to change our strategies to compensate for that.
No, wholeheartedly agree. Tara, do you want to add to that?
No, I completely agree with what Anna's mentioned. And I think on our end, I think we were also, the beginning of the pandemic, it was somewhat more comfortable, somewhat easier, somewhat a breath of relief for many people. Oh, I can work from home. I can wake up whatever time I want. But because people hadn't really anticipated, the real implications of what this normal for us would be. And I felt like as we went through lockdown, and as people started, especially as the numbers were rising, during that time period, we started to see people becoming more conscious of their surroundings, people being a lot more anxious for their family members, even where they had to isolate or where they had to quarantine themselves, would have a lot of clients sort of asking us for what sort of advice they had in place for that. And from a financial well-being standpoint, where people then had to end up taking elongated amounts of leave that sort of went beyond their allocation, a lot of questions were starting to arise in terms of how does this work in terms of pay and salaries and us managing our incomes. Fair enough, we're not commuting to work, but the bills are still coming. So, the whole mortgage holiday element then starts coming into the equation. And I think what we've seen now, I think furloughing sort of had an impact as well when you think about the mental well-being element of things, because people started to think, are we disposable? What does that really mean? If I'm being furloughed, what's the future implications for that in terms of my security, my job security? And we're seeing it now more than ever, because there's now a lot more uncertainty with the economy, and people are a lot more anxious. So they are now requiring, different things. People are now looking at income protection and all these other things because they're anxious. They don't know how long they will be in the workforce for, if their business has been so impacted to the point where redundancies will need to take place. So there has definitely been a lot of there's definitely been a lot of impact. But I think the best way most of our clients are providing reassurance is providing support on all ends. So ramp up the strategy in terms of from a mental well-being perspective, and also from a financial well-being perspective, whatever education, whatever reassurances you can provide there as well, then by all means, I'll definitely recommend that be a strategy going forward for organizations.
I think you both have raised some really valid points, because at the start of it, like you said, Anne-Marie, there was this whole slogan that we're in this together. And yes, we were, because it was very much around the community aspect. But I think what's really different is the lived experiences that have really come to light. So whilst we were all in this together, we are all living different. People are experiencing things very differently. Yeah. And that's really interesting and insightful from the perspective of mental health and well-being experience when you also apply it applicable to the inclusion lens, because then it becomes around the experiences, which are the life experiences, and life events often also depend on whether your socioeconomic background, different things, and and I think the impact, talking about the new normal, which I agree with you, I think that is starting to jar me a bit, is people are looking at this to end, and actually what we're seeing is it's continuing, and for the foreseeable future, at least until a couple of people I've read in the different articles or in podcasts that I'm hearing, is like it's going to be around for maybe a couple of years, at least until we understand a lot more about what coronavirus is about, if there's anything to do with the cure, etc. So I think what I would love to do a bit more is talk about that financial aspect, because that is, I would say, one of the key issues that are impacting people. But also, Anna-Marie, I'd really like to get the view about sort of the workload and the expectation, because again, coming back to this thing around people are working from home, and now we're moving, and actually if we can come up with this in the next poll questions as that comes up, now we're moving sort of out of restriction out of lockdown into some form of a hybrid where people are looking to go back into the office or reopening the offices. I would love to talk a bit more about that and actually understand what the difference is, the expectations, how you manage performance, for example, and again, coming back to still having to live life as well as work. So before we talk about that in a bit more depth, our second polls today is how easy has it been to adapt to the new working landscape? And as offices begin to reopen, would your preferred choice be working from home or remotely in the future? So if we could have a couple of seconds to answer those two questions, and then we'll kick off with some more discussion. Give a couple more seconds, and Danny, if you wouldn't mind sharing the results, please. Okay. So, okay, again, very mixed reviews, but very interesting. Marbella's asked me, are we supposed to participate in poll questions? Yes, Marbella. Everybody on the call, if you are able to participate, that would be great. So question one, we've had actually really good mixed review, and actually, interestingly enough, it's been somewhat easy and very easy for the majority on the call, but we've also had a couple of people that are either neutral, a few people that have been neutral or somewhat difficult. So that's actually quite interesting to read, because I think from, again, what I've been hearing, what I've been reading, interesting enough, I thought some of it, majority would fall more so with the neutral and somewhat difficult. But I wonder how that looks like as we're coming into the new landscape. But also I think when we look at people's preferences and choices, we have a few people that want to work permanently from home remotely, mostly work from home, but occasionally in the office, and 50-50. And then some people very much wanting to return back to office-based working. And again, those results don't surprise me, because I think when we've also surveyed our own employees, and I think we're very much at a mixture of 50-50 and actually looking and exploring about that, looking at that flexible working and what does that look like. And it probably will be a bit of a hybrid as opposed to coming back to the workforce fully. So again, I'd love to ask let's go to Anna Marie. I'd love to ask you, kind of from a workforce perspective, again, what are you seeing from an EY perspective? And then Tari, coming to you, it'd be great to see what are you seeing from your own work place, but also what clients are preferencing in terms of that.
So I think we've been very fortunate because because of the nature of the work we do, we very often have to travel. We work in client sites. Sorry, excuse me. So we're actually used to working in lots of different places. So in effect, starting to work from home in itself was just working in another place. I think where the difficulty arose was actually whether your working environment at home was actually suitable for working at home. And, you know, some people are very lucky. You know, I have an office, I have, you know, 2 screens, it's all set up, I'm very comfortable. But when you have people that are living in, you know, a very small apartment, for example, they might not have a desk, they might be working from their dining room table, they might even be working pretty much from their bed. It does make it much more difficult. So again, I think it's one of those situations where everybody's lived experience has actually impacted on how they've adapted to working from home. And because of that, I think that then leads into the second part of it about, you know, how much people want to get back into the workplace. So if your home environment isn't great, and it doesn't necessarily just mean, you know, not having a good setup for your laptop. It could be that you live in a household that's very noisy, or where you've got practicalities such as shielding, but we also have people that are maybe experiencing domestic abuse. And obviously those, as we all know, there's been an increase in those sorts of things during this time. So there's lots of reasons why people would want to get back into the office. But I think for a lot of people that have transitioned well and have a setup that works for them, they are very much of the opinion of, I'd like to carry on doing this in some form going forward, be that 50-50 or working from home all the time, or something in between.
And Tari, what are your thoughts and what are your experiences on that?
In terms of my personal experiences with our organization, because of what we do, it's very client-centric. We've always been very much office-based. So this was a first for the whole business to now transition to being everyone seeing each other every day to working from home. So unlike you, Anna Maria, we didn't have that ingrained in us to begin with. So it was a lot of trial and error, a lot of Teams meetings in the morning, afternoon, and evening to begin with, to try and keep that communication line open before we transitioned to actually finding our feet. Part of it was also then having to set everyone up in terms of technology, which was a huge thing, because with most organizations, as with most organizations, we do have a young workforce, but we've got an older workforce as well, who sometimes are challenged by having to constantly be, you know, on screen time, etc. So that was also just quite an interesting thing, and that created a little bit of tension to begin with. But I think one of the things that really impacted, you know, us, before I even go into clients, was just the suitability of home environments. And these are things we take for granted for all our colleagues. You know, you never really think, oh, what's their working lives like? And I have colleagues who really struggled because they lived with large families. So even, you know, having these Teams meetings was near enough impossible, or engaging or participating, because there'll constantly be noise in the background, and they start to feel not necessarily embarrassed, but they just weren't comfortable sharing that, and that exacerbated the stress because they felt like they weren't contributing, and then they felt like perhaps it'll be deemed that they're not working. And that was something we had to deal with a lot, especially in the first few weeks, if I have to be honest. But eventually we found a rhythm, and we do have quite a few we've got 2 mental health allies in the business who are really good at sort of just catching up with them and reassuring, reinforcing, and we just had to change the method of work with them to just make sure that communication is still there. Now, and things like lived experiences as well, in terms of, you know, people with children was struggling. I have colleagues who have 2-3 children. One of my colleagues actually has, you know, children under the ages of 10, I believe, 2 young boys, and she was going crazy because she's like, how do I educate them and entertain them and ensure that they don't break the house apart whilst I'm also trying to balance the work life. And that created a little bit of tension for her in terms of just managing the workload. So we, as a business, you know, there were different policies and procedures that had to come in place to support those sort of individuals. And what else? And then from a client perspective, I think we had a good mix as well. I think a lot of our clients were experiencing similar things to what we were experiencing, and similar to what Anna mentioned. The element of going back to work now is now a conversation that's constantly being discussed, especially in our business. We've run a few polls, so our management team ran a few polls just asking individuals, how comfortable are you to get back into the office? Our offices have been open since August, by the way. And at the moment, a lot of individuals have come back and said, we are not comfortable. And you're finding that a lot of organizations are not comfortable themselves because they don't also have the capability to implement some of the social distancing requirements that the government has put in place. So people are hesitant to go back to the offices. And if anything, the ideal utopia in this new world of working that I'm hearing more and more about when I'm speaking to clients or when I'm speaking to my colleagues is, we don't mind remote working being the new thing, with a few exceptions of a few days in the office, maybe 1 or 2 days in the office, but ultimately this is where people are going. The idea of going back to working in the office full time is actually causing a lot more anxiety than comfort.
Yes, and I think that's really interesting, because I echo definitely all your thoughts around that, because I think, again, listening to the news, researching and reading, it is very much people wanting to have that hybrid effect, because people do miss those water cooler moments and still want to have that. But the huge thing about the anxiety at the moment is the health and safety. Well, am I safe traveling in, first of all, and getting on the trains and transport, and then also the social distancing? Do we have enough space, and is there enough, you know, sanitizer, whatever it is, that will help in terms of mitigating me catching the virus or spreading? And I think that is the one of the number one things that are impacting people's decisions to want to go back into the workplace, definitely from a health and safety perspective. But I also think that going through this pandemic has exposed a lot of things in terms of how you work and where you work, which has always been a conversation, whether it's been professional services or at startups, in terms of how that flexibility and mobility of people and workforce. And I think what's a really interesting thing that has come out of this has been around, well, actually, what does that look like? And in essence, what is the best place? How do we support individuals and employees to make sure whatever or wherever they are, they thrive in and able to do so? And I mentioned, and what I would like to talk a bit more about before we go into our final poll, is very much around the expectations, because now we were on lockdown, and like you said, Anna Marie, if you are used to working from home once or twice a week, you probably set your home around for you to be able to work from home if you did that regularly. For those that had been working remotely, I'm pretty sure they've probably set themselves up properly. However, there have been other people that are very much new to this and suddenly have had to share their spaces in a very different way, because yes, they're sharing with either large families, housemates, children, etc. And what I found really interesting was I was reading something to do with more so around schools, and how the expectation was that every household would have equipment. So for example, just have laptops to be able to, if you have 3 children and you've only got 1 laptop or 2 laptops between, how do you then share that with the children? And also the things around broadband, we took a lot for granted in the sense that every household would have broadband, or have broadband that was efficient enough to deliver the work. And I think as we've kind of pitted through the pandemic, and we're still kind of going through it, even though now we're going through a more relaxed sort of way of life, in the sense of the restrictions are not as bad as they were before, things have popped up around you know, the blurred lines between work and personal times. You know, I was actually, before I came on this call, I was talking to a friend who mentioned that, you know, she had clients calling her before 8 o'clock because they thought they could, whereas actually, hang on a minute, just because we're remote calling and I don't start work until 8:30 or 8, impromptu, by the way, it wasn't planned, that was okay. And I'd really like to dive a bit more into this, because I do think this is very pivotal to people's mental health and well-being around how do you then how do you put those boundaries in place to make sure that you are not blurring, or you're not working all hours till God sends, or waking up at 6 o'clock or 5 o'clock in the morning just because you've got deadlines and you're constantly on Zoom, or you're constantly on, you know, on the laptops? Like, how are your organizations supporting that? And also, let's talk a little bit more about performance, because now it's going to have to look a little bit differently when we are now assessing people remotely and according to, you know, what's agreed, etc. So I would love your input on that, in terms of what you've been experiencing, how your organizations are supporting them, or what your recommendations are to clients. And I don't mind who wants to go first on that.
So I'll start, and I think it's a really valid point. And in professional services, we are used to working long hours. You know, it is part and parcel of the job that we do. I think, like you say, one of the challenges has been, however, that because people are known to be at home, that it's known that they're not commuting, those sorts of things, it has actually created in some people's minds this perception that you can just contact people at any time. And I think one of the things that we've been talking to our teams a lot about is around boundaries, and actually saying to people, look, you need to be able to, we need to understand when you are available. And it could be that actually you're available from 8 till 12, and then you need to be away from the desk from 12 till 3 because you're, you know, sorting out your kids' lunches and all of those sorts of things. And then you might be back online from, you know, 3 till 7 or whatever. But whatever that structure is, we need to be, as a team, understanding what that structure is. And also helping people understand that just because you're not commuting doesn't mean that you should be working even longer hours, because actually there are a lot of synergies from working from home in terms of things like productivity. Because whereas before you might have been moving from client site to client site for meetings, for example, because everything's done on the phone now, you've gained back that travel time that you might have accommodated for previously. So it's recognizing that just because you've gained additional time on one hand doesn't mean that you haven't gained it in other places. So boundaries are really important, and we've really encouraged people to pack up their laptop. You know, at the end of your day, pack it up, put it in your rucksack, chuck it, you know, where you would have done when you came home from work, so that it doesn't get mingled in with all of your dining room table stuff, and it removes that, oh, I'll just quickly check to see if I've got any emails because my laptop's there, you know, and actually trying to help people put those boundaries in place. But we have also recognised that actually sometimes you can't flex your working hours around life, and we did actually increase the amount of special leave that we would provide for people to deal with those sorts of things. So, you know, for the rest of this year, we did double the amount of special leave that we would allow people to take, so that, you know, they could use that additional time, you know, to build some flexibility into their diaries. But it really does come down to communication and actually talking about what can I do in terms of when can I be available, and also making sure that you do have those distinct boundaries, and that is easier said than done.
It is. Tari?
I completely agree with you, Anna. I feel like I've been agreeing with you all this while. In terms of the boundaries that we had to put in place, so when we started, similar to you, I think the financial services sector, although we cover financial education, we work with a lot of professional services firms and financial services firms. So you find that our working hours mimic theirs. sometimes I'll get emails from clients at 9 or 10 and I'll be quick to respond. And in the beginning, I have to say I struggled with the balance, because I found, because it was uninterrupted work, I was like, I'm more productive if I do all this, I'll get it done in one day, and before you know it, I haven't got up for lunch, and it's 4 p.m. I'm like, oh, I need to get my lunch now, but I still have some stuff to finish, and then before you know it, it's 8 p.m. right, and you're still on your desk, and a lot of us experience that within the team. So we had to, and through communication, had to now put some boundaries in place. And one of the things that we implemented were the start of day meetings. You know, it sounds very regimented, but our working hours are typically 9 to 5:30. So we start off with a 10-minute start of day meeting at 9 o'clock. And by doing so, I felt, you know, what we were just trying to communicate was, you are not obligated to be working beforehand. Don't do anything that is out of the norm to try and, you know, sort of accommodate this new way of working. And those have definitely helped a lot, because sometimes you do feel guilty. Am I doing enough? I'm not. But no, actually, I'm starting the day same time with everyone else. I just need to pace myself a little bit better. Then the other thing that we did on the other end of the spectrum was then put an end of day catch-up call with the respective teams and departments at about 5:15, because and that usually takes us through to about 5:30 anyway. Again, it's almost a way of saying you're rounding up for the day now. So if you're done, it's okay to step away from your laptops and shut down. And that has helped instrumentally. I cannot say how much that's helped, but that's definitely helped, especially in my case, because I am one of those people who typically gets carried away. And we use Microsoft Teams a lot in the business. And one of the things that we've also really been conscious about is the status update. Before you message, just check someone's status update, because if they're away, if they're busy, if they're on a call, we need to be able to respect that. Otherwise, you don't know what people are currently doing or engaging in. It may make them a little bit more, not necessarily exacerbate any stress or anything of that nature, but you just don't know what people are doing. So especially if I have to go for lunch, then it's on me to make sure that that status is up to date, so that people can respect that time. Because what I found, again, working from home, if you message me, I have Teams on my mobile phone, I'm messaging back straight away.
Yeah.
Right.
And actually having booked lunch in your diary.
Yes.
And saying that time is protected is actually really, really beneficial.
So important. So important. We are becoming more conscious of people's diaries now more than ever before, because before, you know, you just walk to someone's desk. It's not a problem. You know, oh, they're eating. You don't really mind me disturbing you as you're eating at your desk. I just have this quick question. But now, if we're doing it every day, then people just don't have a good work-life balance. So those are some of the things that we put in place, as well as things like team luncheons every so often, so that even if you're stubborn and are very determined to work, you have to show up for the team lunch. We can schedule one team lunch a week. That helps so much. And it's lunch on Teams and everyone's just eating and talking away. Sometimes people are even cooking in the background, but they just have it open just so people know that this is what we're doing.
And I think, sorry, I was just going to say that I think because our workforce is working so many different hours to accommodate all of their different circumstances,
yeah.
it is trying to find that potentially that one moment in the day when you can actually get everybody together. And it could be 10:30, it could be 3 o'clock, but obviously trying to keep those within reasonable core hours.
Exactly.
You know, and really focusing on that. But if you can find that one time in a day when your whole team is around and utilizing that, I think that's really helpful.
It definitely goes a long way. And because one of the things that we also noticed was, you know, sometimes it becomes very department based, which is why the whole team lunch thing came in. Team lunch is for the whole business. Everybody just come together. It's almost like our lunch canteen, our canteen room on via Teams. But the morning catch-ups, that's usually very department based. And that's good to have, because, you know, you're still connected. Everyone knows what they're doing for the day. We're up to date with what's going on, etc. So yeah, it's definitely boundaries on communication is my feedback.
Thank you. Can we get to the final part? And as we are, I think it's communication is definitely a key thing, but I also think there's that thing you mentioned. For me, it's around understanding what your boundaries are and actually putting those in place and not budging from them, or, you know, having to renegotiate unless it's required. But also I think there's a big thing around, like you mentioned, that connectedness, whether it's with your teams, your directorate, your departments, or peers, and how you can continue to have that whilst you're working from home remotely. And I mean, I know we've been focusing very much around people that have been able to work from home, but I'm also very conscious that yes, there is still very much those individuals, for example, frontline people that haven't had, I wouldn't say the luxury, but I'm not as fortunate as those that have been able to work from home do so. And I think thinking about how that balance to support is, where you're in an organization that has a bit of both, where you do have people that are frontline and those that aren't, how do you keep that connectedness going? But also I think from that perspective of how do you bring people together and make sure people do come together, whether it's a line manager responsibility versus actually just checking on your peers and your colleagues as well, just to see how they're doing, and giving those channels, keeping those channels open so that people feel that they can talk about if they are struggling, or if, you know, workloads are getting to them, who can they go to have those conversations. And I'd like us to dig a bit deeper into that and come back to that piece around financial wellness too, because I think that is quite critical when we're thinking about the whole thing around well-being, not to just think about things in silos, but actually how it impacts everything else. So for our last piece of conversation or discussion, but also from linking into the poll, I'd really like us to talk about it and then take questions from the participants. So as we move into the new working landscape, do you feel you have received adequate training to feel confident to support your staff's mental health and well-being? And yes, very confident, somewhat confident, no, somewhat unconfident, very no, very unconfident, or unsure. A couple more seconds, and then Danny, please do share the results. Oh, this is actually quite good. She says surprised. So yeah, so you've the majority of you are somewhat confident, stroke very confident, that you have received adequate training to feel confident to supporting your staff's mental health and well-being. There are still a few of you that are somewhat unconfident and unsure. So it's a good mix actually, and a good balance, which is quite good to see. And Tari, so let's talk about that adequate training. What do you, and I know yours is specifically probably from that financial lens, but I'd be really interested to understand or find out about what training you have provided internally for your staff, but also what kind of advice or training have you provided or given to your clients or suggested to your clients in relation to this question?
So from a mental health standpoint, I think I do stand with, I think the top tier 35% in terms of saying somewhat confident. We've had a lot of support in this space. We've had a lot of mental well-being trainers coming, a lot of speakers coming through, and then providing different webinars and seminars for us to sort of attend for different things, be it anxiety, managing anxiety during these times, how to regain control if you feel like, you know, you're sort of losing that control element. And so we definitely have been very much well supported, and I feel I can say the same for a lot of our clients. There has been a lot of, and I'm really grateful for that, there's been a lot of work been done in the mental health and mental well-being space, thanks to the pandemic, a lot more than we had been seeing before. And it's definitely shown a light in just how people have been able to cope in such dire times. Now, from a financial well-being standpoint, because the two, as I alluded to earlier, work hand in hand. We have found ourselves being called to just provide more reassurance. Things like furloughing and people worrying that they were going to lose a particular percentage of their income, you know, where organizations have had to defer bonuses. Some organizations actually ask for people to sort of take voluntary pay cuts, etc. They have now felt the need to provide support in a different way in terms of just reassuring people that you will be okay. And that's where we have had to step in and just educate people on how to make better informed decisions with the finances that they have at this present moment in time. And that's something that we've been doing a lot since the pandemic. Again, you know, it's sort of worked out well that it's also now pushed financial well-being into the forefront, something that was a maybe and a lot of HR's, you know, to-do list is now definitely we need to provide support right now because we just don't know where the future is going. So we've been doing a lot around getting people to just understand the principles of and the basics of financial planning for today, for tomorrow, and for the future, how to be more conscious right now, because we found that there were two different types of people that we are finding from this pandemic. We have those people who have saved the most amount of money ever because they're not commuting to work, because they're not, well, they hadn't been commuting to work, they hadn't been going out, the gyms were closed, so people were saving money, right? But on the other end of the spectrum, we also had those people who were furloughed or made redundant, and people were struggling. So it's just about making sure that you're educating people where they are. And that was part of what we then come in to do. And part of our give back, we had we actually did a promotion, which may still be running actually, but we had a promotion running last month, where we were just sort of providing a free introductory webinar on financial education, which was very much holistic and very much targeted at just getting people to think, am I doing the right thing with my money right now? Because you find that people are a little bit anxious on both ways. And right now, if you were to ask me, this is the time to be the most frugal you've ever been. Right? And it's just about getting people to start realizing that if I don't control this now, if I don't lay out the right foundation now, then in the next 3 months, I may find myself drowning, especially with Christmas and all these things coming up again. Mm-hmm. So it's just providing that support and that education where people are and where organizations can also take it in and think, okay, if we were to do this on a serious level, or if this is a strategy that we want to implement, at least this is what it looks like and this is the impact that it will have.
Thank you, Tari. Anna Marie, do you want to add to that and from your perspective?
I think, yeah, I'm off mute. I think personally, and you know, as a company, I think we've done a huge amount to actually make people feel supported around mental health and well-being. You know, we have regular webinars that run around all sorts of issues, you know, how to sleep better, how to deal with, you know, eating well and those sorts of things. You know, next week we've got a session on, you know, coping with anxiety and burnout and boundaries, you know, so there's a huge amount of support out there. I think for me, I suppose I'm starting to think about a bit more the next few months, because as we've said, you know, the needs of people has changed significantly over the time of this pandemic. And I think, you know, we're heading into winter, which is typically a more difficult time for people because, you know, an increase in seasonal illness, for example. But I think also it's going to mean that people can't get out of the house as much. Maybe they're not going to be able to socialise as much, you know, because it's going to be raining. You can't go to the park and meet up with friends. So I think you know, there's a big impact coming around winter, and we need to be thinking about how we can support people through that, because we have been lucky that this happened in a year when actually the weather's been pretty good, and you know, there's been lots of lots of ability to be able to get outside. But I think the other issue that we also might need to be contending with is, as people do start going back into the office, for those of them that feel comfortable to do so, is making sure that people don't feel as though they have to, and potentially introducing a whole raft of presenteeism, because actually we've all been able to show that we can work successfully from home, and some people have shown that despite some very difficult circumstances that they've been living and working in. And what I would like to see is actually we use that as a stepping stone to actually improve life for people and move away from this: if you're not in the office, if you're not being seen by X, Y, and Z, that means you're not being productive. So I think, this is quite a good time when we can really be supporting people to make positive changes to their life, which will improve their mental health and well-being, by taking on board what we've learned over these last few months, and applying that in the future.
No, I completely agree, and which is why I raised the issue around performance management looking very different now. Because I agree with you. I think there shouldn't be this competition between presenteeism and them versus us, i.e. office people versus home people. I think organizations need to start really thinking creatively and smartly around how they are inclusive, both remotely as well as those in the office, and how do they continue those interpersonal relationships, how you build on that, whether it's group, team on team, department on department, or peer on peer. And I completely agree, because I think you could still be present and still very much impacted by mental health and well-being and not being productive by that. So I think that, we should definitely take the lessons, because hindsight, as they say, is always a blessing sometimes. You take the lessons you've learned and think about what future you want to create for your workforce. And I think as we're moving towards a future where it is very much intertwined with life, it's almost like lifestyle and work are kind of coming back, are merging together. We need to think about how do we do that in a more healthier way, where people have options, or provided with options that enable them to thrive both in their personal and also professional life, and that actually links into their well-being. I also agree. I think there's lots of things that we've been thinking at Mental Health First Aid England, and how we support our employees and our staff. Most of us are mental health first aiders. We do go on the course and are trained. So we need to think about how we implement that within our own, spaces where we're talking about from our central teams, but also how that's reflected in our communities. And I think there's a huge thing very much around, the flexibility, whether it's through hours of work, how you're supported, to think about really how that means and how you thrive. Because as we are going into this organization where we are having multiple layers of generational, but also very much around different life experiences, we really need to think about, actually, are the initiatives that we've got on board supportive, but also what we're offering from a support mechanism and support, whether it's EAP, is that sustainable, and actually is that still relevant? And how is that relevant in the world we're living today? But are we also supporting our workforce with what we're actually, supplying in essence? I'm also very conscious of time, and I know that we might have some questions. We've got probably about 5 more minutes left, and I would love to pick up a couple of questions if you've got any, but also I would love to wrap up and round up by maybe just giving a couple of, I don't know what you want to call it, recommendations or suggestions in terms of your thinking of what you would hope to see in the future, or for us to start thinking about very much from a professional services lens as we're looking at mental health and well-being. So I'll just check to see if there's any questions. If not, I will probably try and see if I've got any. We've got a few comments around just loss of confidence in my manager's ability to support my well-being, but also around contrary view of winter illness is that setting aside COVID-related implications, I foresee the flu-related sickness would be lesser this year due to low social contact and commute. I've got a question here that says, would they do a mental health and well-being for frontline workers? Interesting question. I'm looking like I'm curious, but I'm actually reading some of these statements. That's why. So that's actually an interesting thing, Aaron. I think looking at mental health and wellbeing for frontline workers, because I do think that it's a different group of workers compared to those that actually are able to work from home. So definitely think about that, Fiona. I will take that away and speak to our central team and see if we can do something around that. We've got, what simple route can I have with a major impact on my mental health? So these are very much, I think, just very much general statements, as opposed to, hang on, I've got a question. We've got to, I spoke too soon. I've been working from home 1 day a week as a key worker and found that as others are returning to work that we've been overlooked as a group. Okay, so that's the statement. Can we schedule another similar chat with my communities? Another person that's asking. So actually these are more comments than suggestions. So I will take all those comments on board and get back to hopefully answering them offline. We only have a few minutes left, and I think there's some really good comments here, just very much around just thinking about, as you're saying, Anna Marie, the dark nights that are coming on from winter and the seasonal changes, and how, again, there's that impact individuals on top of thinking about, the pandemic. Just going through quite a few of them really quickly. Here, I'm a paramedic, so we've got quite a few different people online here that have actually talked about the mental health declining just because of the experiences they've been having. What would you say, just to wrap up actually, what would you say, from just to summarize everything we're discussing, what would you say are some of the crucial things that we really need to think about as we're going, for the next, 5 months left of the year, but actually as we're going into next year, what are some of the crucial things we should be thinking about when we're talking about professional services because that's the industry we're working in, but from a mental health perspective, thinking about it and how we service the employees and workers in that professional services industry a bit better, from just your experiences, but what you would hope to see as well. Tari, should we start with you? Oh, sorry, Anna,
yep.
Anna, go ahead.
I was just going to say, I think it's important to remember that it is constantly evolving, and what is working for your business today might not be what is going to work for your people tomorrow. And it is actually looking forward and thinking about what are the potential things that might be arising, so that rather than reacting, you can actually be putting systems and processes in place to support people in advance, and really just helping people develop routines that work for them, and that might be going out for a walk before you start your working day, blocking time in your diary to make sure that you have lunch, whatever those routines are that work for you, then keep doing them, because those are the things that we tend to drop when we're feeling stressed and under pressure. So routine is actually really, really important, as dull as it sounds.
Sir, I was just going to say, I do agree with you, Anna. I think one of the things that I was going to definitely say there was, because the landscape is so unclear when it comes to the next 3 to 6 months, there's need for us to be flexible with our wellbeing initiatives to ensure that we are providing relevant support, not just what we think. So there's a need to constantly be reviewing those strategies. I would definitely say every month, let's review, let's catch up, let's see where we are, let's see the impact that was had in the last month before, what questions came up, and let's see if we need to make a change. Because in my mind, if it's not delivering impact, then it's pointless. And we've already seen in the past few months people having to change benefits providers, all these other things, because they realized these were nice to have, but they weren't actually relevant. So being nimble with those initiatives definitely is one thing that I would recommend. Now, the next part would be what you mentioned, Anna, as well, in terms of, I'm always one for looking ahead and trying to see what potential pitfalls they are. Let's put preventative measures in place. And why I love the Mental Health First Aid Allies is because you guys are educating people to be able to identify those pitfalls, right? You're teaching people to identify the triggers. before they even happen, before somebody actually has a crisis. So preventative measures versus reactive measures are, for me, the best in all cases, be it financial well-being, mental well-being, you know, physical well-being. Let's make sure holistically, in terms of our well-being, is preventative aligned. Otherwise, you will be playing catch up, and in playing catch up, it will have a detrimental impact to individuals and to the business. So those are probably my recommendations and takeaways from this.
No, I definitely, again, echo with both your suggestions and recommendations. We do have a couple of questions, but unfortunately we are at time, so we will try and think of how we can answer the questions that have been asked. But I agree with you. I do think, you know, we've also, on our slide, you can see some useful links that, again, can help support and make you think about how you approach mental health and well-being within your workplace. But I totally agree with you. I think that, you know, long gone are the days where things were remaining static. And with mental health, we know it's a continuum. Mental health and well-being is a continuum. So we need to address it in the same light. You know, I agree with you in thinking about reviewing things, but also I think checking in and actually making sure the things that you're reviewing actually are supportive of the individuals you're trying to support. So making sure that they have a regular voice in what you are reviewing and actually trying to support them, so that you're making sure that you're giving them the right support. And I also think that if you do have mental health first aiders in your organization, absolutely making sure that they are supported too, so they are able to support others. You know, I think it'll be very much interesting times ahead. I think the pandemic has brought mental health and well-being onto a spotlight that we probably were taking time to get to, you know, and I think in the positive way, that's one of the best things to come out of this pandemic, is that we're now talking about mental health and well-being. But within that, I think we need to make sure that we have the diversity and inclusion of those voices in there, those lived experiences, and also how we then support whoever are people managers in organizations to make sure that they are able to support their teams and the individuals, but also to help them support their own mental health and well-being. So, you know, I think this is definitely an interesting conversation which will carry on and keep going on. And I think that, you know, that it's just early days of discussion, and I'm looking forward to seeing how that actually pans out. So I would really like to take this note to just thank you both, Anna Marie and Tari, for taking the time out to have our discussions with us and to just talk about what's been going on within your own organizations, but just generally in professional services. I'd like to thank everybody that has been part of this conversation in terms of our participants. Apologies for those that we weren't able to answer your questions. We will find a way to do so. If you have any, again, questions or comments, we have our workplace email there for you to drop a line to us. We're happy to, you know, receive and feedback would be great. But I think we probably will, I think that there's a sense of a part two in this conversation. So hopefully we'll be able to do this again. But I just want to thank you all, and thank you all for your insight and recommendations. I hope you all have a great day and a great week.
Thank you so much for that.
Thank you.
You're welcome. Thank you.
Thank you. Have a good day.
Bye, everyone. Have a good day.